Hello and welcome back. In today's video we will discuss a case of 47-year-old male who presented with puffiness in his lower eyelids along with loss of support from his cheeks. He was a male patient and he wanted the surgery to be in a way so that nobody ever finds out that he had this surgery. He wanted his surgery to give a very subtle refinement to his face so that he looks younger than what he looks right now. So if you also suffer from eye bags, this video is for you. Hi friends, I am Dr. Ankit Gupta. I am a plastic surgeon and I practice in Delhi, Pitampura. Today, we are discussing this case of this young gentleman who is 47 years old. As you can see in his pictures, he has a lot of puffiness below his eyes. His main complaint was that he looks older than his age and his puffiness bothered him for last 10 years. He was not happy with this swelling beneath his eyes. He never used to drink, but still his friends used to say that you drink a lot and that is why you gain this swelling and that is why you have this puffiness beneath the eyes. In spite of a good night's sleep, people would comment to him that you haven't slept properly, and these things bothered him. Now, how is a male patient different from a female patient when we operate for eyelids or for puffiness or for fat grafting? Now, it is very important that males usually do not apply a lot of makeup. They don't know how to apply makeup. They cannot cover their face with makeup. Secondly, they do not apply kajal or eyeliners beneath their eyes. So, giving a scar beneath the eyelid is again a little bit of an issue with a male patient. Males do not want very bulky cheeks. You have to make sure that the volume that you give with fat grafting is limited in the anterior portion and not too much on the sides or the cheek area to make it look very natural, to give a very subtle change and to keep it very natural looking. Now, when I analyzed this patient, I found out three major issues. One was these eye bags, as you can see, which he also pointed out. The second major issue was the hollowness which was in the mid-cheek area. There was loss of support of the cheekbones. Now this happens as we age. What happens is in aging is that our cheekbones, they tend to shrink. There is a bony resorption which happens and that is why our skin sags. So that is why we added fat grafting for him. We used this special micro droplet technique to give a very subtle and a very natural looking result. The good part in him was the skin quality that he had was really good. In spite of him being 47, the skin did not show a lot of wrinkles and that is why there was not a lot of loose skin in his case. So we need to understand this. Sometimes patients come to me only for the treatment of eye bags. But many a times eye bags, they do not look worse because of those. The face looks worse because of the loss of support in the cheek area, and it is always important to address both the issues. If only eye bags are removed and the volume is not given to the cheek area or the loss of support is not addressed, this whole area does not look good. It is always better if you have lost volume in the cheek area to correct the lost volume along with improving your under eye area. Now combining these two procedures, that is the transconjunctival blepharoplasty, that is the blepharoplasty, that is eyelid surgery from inside the eyes without giving any cuts on the outside, helps us in two things. Number one, there is no visible scar, and number two, the amount of complications that can happen with blepharoplasty reduced drastically, because when we operate from inside the eyelid, we never injure the muscle which supports the lower eyelid, and when you don't injure that muscle, there is no chance of your ectropion, that is your eyelid, drooping down. Now, to increase the volume and to handle this area, we always add fat grafting. This supports the cheek area and also gives volume and thus helps in skin expansion. Giving the scar on the inside also helps in faster recovery, as the conjunctiva heals much better than the skin, and it also never leaves a scar. In a male patient, if there is a slight scar beneath the eyelashes, it makes an appearance of applying a kajal in the initial months. Now if you are much older, or if in case you have a lot of loose skins, you tend to have a lot of wrinkles in those areas, and then giving a cut outside is to be done. That is, we can add pinch blepharoplasty in those cases. But in him, we tried to avoid it because he had very good skin quality and because we added fat in his case. We also did a bit of nanofat grafting along with microneedling to give a little bit of natural stem cells to the skin along with tightening of the skin, which would help in skin shrinkage and avoid any wrinkles in this area. If we talk about the surgery per se, the surgery was about 1.5 hours under local anesthesia. We took out the eye bags from inside, we took out fat from the tummy, we processed it, and we injected in the cheek area, the malar area, also a little bit in the temple and the sides to give a more natural appearing result. And the patient was discharged after 2 hours of the surgery. He was advised to put ice for almost 2 days so that the swelling is under control. The medicines that you need to take after the surgery is for about 5 to 7 days, which includes a few eye drops, one ointment, and a few medication to avoid any sort of infection and to reduce the swelling. The swelling can be there for 7 days to up to 14 days. The bruising can be there for about 10 days. In his case, the bruising and the swelling continued for around 10 days and he was able to join back his work after 5 days because he had his own work. Now this is his final result. As you can see, the eye bags are completely gone now. The cheek area is much fuller. It is well supported now. You don't see any hollowness in this area. The skin looks much better. It does not look like an operated case, does not give a very plastic look, does not give like you have undergone knife or you have changed a lot in your face. It just makes you look a bit younger. It gives or it reduces a few years from your face and it actually addresses the problem that you came for. So this is how his result was. In case you also suffer from something like this, you can always approach our team. We'll be happy to help you. Thank you and have a nice day.